Hi, good afternoon, everyone. This is Dr. Sarkar. I am the fellow in Child and Adolescent Psychiatry in Psychiatry Department of Texas Tech University Health Science, Permian Basin. Today we will discuss about the situational depression. Is also another name we call adjustment disorder. In 2021, 3.8% of US adults had at least one major depressive episode of depression in the last year. Prevalence of depression increases with age and young adults. Depression is common in women, young adults, and people with lower education levels. Situational depression is also known as temporary form of depression that is triggered by the specific stressful or traumatic event such as loss of loved one, job loss, relationship breakup, financial difficulties, and major illness. Women are likely have higher experience of situational depression than the men, and there is no age cut-off or age difference between men and women for situational depression. Symptoms of situational depression: persistent sadness or low mood, fatigue, changes in appetite or sleep, anger, irritability, difficulty in concentrating, feeling of hopelessness or worthlessness. Diagnosis: there is no clear-cut specific diagnostic test for the situational depression. Clinical history, presence of symptom, and a clear precipitating event helps us to diagnose the situational depression. It is important to note that situational depression is different from the clinical depression or major depression disorder, which is more severe and long-lasting conditions. Situational depression needs to differentiate from clinical depression or major depression, which is a mood disorder that may happen with or without specific events. Most common symptoms is depressed mood most of the days and lasting for a long time. It usually more severe than situational depression and typically lasts longer. Treatment of situational depression: psychotherapy, talk therapy, cognitive behavioral therapy can help individuals cope with the stressful event and develop managing their emotions. Support groups connecting with others who have similar situation experience can provide support and understanding. Self-care: engaging activities that promote well-being like exercise, healthy eating, enough sleep can also improve mood and reduce the stress. Prognosis: situational depression or adjustment disorder often improves after the time passes after the stressful event. If the situational depression is not resolved by its own or is not treated, if it is persist more than 6 month period, it may turn into major depressive disorder. And that's the reason it is very important to understand the situational depression disorder and need to treat it early. If someone has situational depression and it's not been resolved or it's not been treated, the possibility is turned into major depressive disorder is very high. So the situational depression disorder is like a minor health issues at the beginning, but if left untreated, it could be a major depressive disorder, which is a big mental health issues in future if left untreated. That's the reason if someone has the situational depression disorder, being as a psychiatrist, I recommend all of you to consult with your psychiatrist or a therapist. Treat it early to prevent the worst complication in future. If you need any further help regarding this situational disorder or any mental health disorder or any depression, please contact with us. We are here, a psychiatric clinic, 2301 West Michigan Avenue, Permian Basin, Midland, Texas, and our phone number is 718-620-1156. We are always here to help. Thank you for listening to me.